Good morning. Time for that house call with Dr. Andy. And this morning we are talking about those self-screening units, I guess, or devices you could call them, in the mall. You see them at Walgreens, the blood pressure cuffs and everything like that, the life screen things.
Right.
And you say, you know, maybe it's good to give you a heads up, but not always the most accurate.
Right. I originally started looking into this because I've had several patients in the last couple of years ask me about I think it's called lifeline screening, to give them the, to mention their name correctly. And basically, for about $100 or $200, they do screening tests that look at your neck arteries and your abdominal aorta, and they look for osteoporosis, and what's called an ABI test that looks at your leg arteries. They do a bunch of tests at a relatively cheap price. And so, for understandable reasons, patients are attracted to doing that kind of thing.
Right, kind of maybe find out your baseline, where am I at, am I in trouble, that sort of thing.
Exactly, and so I looked into it, and also have had several patients come back with their results, and my advice to patients typically is, don't go there. Don't get those types of tests done, because if you really need to have a screening test done, then let me send you to a local state-of-the-art radiology facility to get it done correctly, so we don't just have to repeat it again if something comes back abnormal.
And somebody might argue, well, you know, I don't have insurance, or I can't afford that price, you know, this, I can get the medical test, at least I know where I stand. And
that's probably the best argument to consider something like these lifeline screening tests is, if you really can't afford to go to get a real bone density scan, which might be between $100 and $150, just for the osteoporosis screening test, then, and you don't have insurance, then maybe it might be worth considering doing the lifeline screening as a last resort. But for the typical patient, I usually recommend don't do it. Don't do it. Talk to your doctor first.
Talk to your doctor first. Now, if you're somebody that's like, oh, I need to kind of figure out where I stand on some issues, my bone density, you know, my arteries, my plaque levels, my cholesterol, where should you go? Just your physician's office?
The first thing to do is actually really just talk to your doctor. It sounds oversimplified, but a good history, a good exam done by your doctor, and a good review of your risk factors can often determine whether or not you're really at risk for those things. And if so, where to send you for the appropriate testing.
Kind of sounds like if it's not broke, don't fix it, and otherwise follow that age-old physician's advice. Call and make the appointment. If you have any questions, you can reach Dr. Andy at info@drandy.us or 239-694-6246. And don't forget, email him your medical questions. We can use them for this segment and help him get them.